Just want to welcome everyone to our session, Health Equity, the Imperative to Move Kidney Health Up the Care Continuum. I'm Jackie Bishop, and I have the pleasure of serving as the CEO for the National Kidney Foundation of Illinois. And my co-presenter is Monica Fox. She is the Director of Outreach and Government Relations for the National Kidney Foundation of Illinois. And you'll hear more about Monica later within our presentation, our conversation, as well as our backgrounds are available online. So in terms of guidelines, you can enter questions into the chat. It's, a small group. We can certainly engage, and we want this to be impactful and meaningful. So our learning objectives include: the audience will be informed of the impact of kidney disease in communities of color. We want you to walk away with strategies that implemented through to raise kidney disease awareness on a statewide level, and identification of our next level engagement to move kidney health up the care continuum as an example of sharing and welcome the feedback. So who are we? So the National Kidney Foundation of Illinois, we have our mission and vision on one side, and then our core values, which we know are so important. So, with our mission to improve the health and well-being of persons at risk or affected by kidney disease through prevention, education, and empowerment. And we are a lifeline for all people affected by kidney disease, and we are relentless in our work. Our core values include integrity, respect, learning, partnership, and inclusivity. One thing as we were completing our core values, we talked about the challenges. You can be diverse, but not necessarily inclusive. So we wanted to assure that inclusivity, which it is one of our core values. We are an affiliate organizationally. We are an affiliate of the National Kidney Foundation and partner with our national office, our national team, in a variety of capacities. One very much in the policy and advocacy arena. We are enhancing our engagement with some of the programs, and then clearly the National Kidney Foundation, which is headquartered in New York, has implemented a patient network, which is very exciting. And there is a national marketing campaign, Are You the 33%, which when you go to the website, which is also on our website, we are nkfi.org. When you go to either website, there's a survey available to see if you're at risk for kidney disease. So moving forward, this slide really summarizes some of the challenges with kidney disease and the issues of moving kidney care up the care continuum, as well as impacting the health equity, of course. So the challenge with kidney care is costly, it's fragmented, it's inequitable, and it's overwhelming for persons that are directly affected, as well as their families, caregivers, and everyone partnering to help the patient through the journeys. So we talk about a little bit about the data. We said we're going to talk a little bit about, the data. So the cost burden for CKD, being chronic kidney disease, is substantial, with over $115 billion annually in Medicare alone. People with chronic kidney disease compose 14% of Medicare population, but account for 25% of the expenditures. The challenge with kidney disease is it's considered a downstream disease in terms of at the point that is usually diagnosed. And that's primarily because there's not a lot of symptoms for kidney disease. So what happens, people remain undiagnosed generally in their primary care settings. And we know that on a national basis, there's 37 million persons with kidney disease, chronic kidney disease, and about 90% are not even aware. And then the risk factors, we're talking about uncontrolled diabetes, hypertension, age is a factor, race, and that relates to some of the issues of health equity, ethnicity, family history, and genetics. So another part of this slide that as we go throughout the community and provide increased awareness, education, people are not generally aware that there's 5 stages of chronic kidney disease. Stages 1, 2, stage 3 is divided into 2 components, 3A and 3B, stage 4, and then when you get to stage 5, and it relates to your kidney, a number of factors, but your kidney function, that is when you are diagnosed in kidney failure at the point that either dialysis or a transplant is needed, is required. A question that we do receive often is, can you move back up the continuum? Can you get back to stage 1? And at this point, although a lot of research is in progress, that answer is no, it's a progressive disease. And what we do first, prevention, and then early detection and preventing the progression. So with that, what we'd like to do at this point, in our talk, is to put a real face, and Monica, who is just an outstanding advocate for change, and have her share her kidney story with you. So Monica, please share your story.
Yes, thank you, Jackie. So I won't repeat the statistics that Jackie just so eloquently laid out, but I can rattle those off in my sleep now. Today I can. But in November of 2013, I was totally unaware of this information. And I probably would have seen a nephrologist before running into him at that IC at the emergency room, had I known then what I know now. So this is a story about impact, and the impact that the sudden diagnosis of chronic kidney disease had on my life. And this is how it started. I'll never forget the date, November 13th, 2013. I was at work. I was the executive director of an orthotic and prosthetic clinical practice with 3 locations in Southern Cook County. I went from work to the ER to the ICU. Much of the beginning of my journey had been told to me by my sister. The last thing I personally recall is going to the ER and sitting in a wheelchair at the registration desk. Then I recall my sister Betty saying, "Your heart rate is high and erratic, and your kidneys have failed." Your kidneys have failed echoed in my head. And all I could think of was, how did that happen? I'm educated. I have health insurance. I go for regular doctor appointments. I was confused. Then she said, "This is a major fight. Are you up for it?" I said, "Yes, because Olivia needs me." She said, "Then they need to put you to sleep to stabilize your cardiac function." I said, "Okay, but I need to know who's responsible for waking me up." So the cardiologist seemed to appear from out of nowhere to answer my question directly. I explained that I had a daughter in college who needed me, and he said, "I'll be the one to wake you, and I'll make sure you attend your daughter's graduation." Spoiler alert, I attended that graduation. I later learned that after putting me into an induced coma, they performed several cardiac procedures, put me on a ventilator, inserted a chest catheter, and gave me my first of many dialysis treatments. And there I was, unconscious and fighting for my life. They had said that I wouldn't survive the first 24 hours, but I did. And that information had a profound impact on my life. I said to myself, there's something for me to do, and it's going to be my mission to figure that out. What I know now that I didn't know then is the statistic that Jackie shared in the beginning. I was one of the 90% living with kidney disease and didn't know it. As I educated myself, I realized that my given mission was to educate others about chronic kidney disease. I learned that although I didn't have high blood pressure or diabetes, the times that I had been told about protein in my urine were signs of possible kidney disease. I would have done things differently had I known more. I would have asked for more testing instead of being relieved that they explained it away. During the 3 years that I spent on in-center dialysis, I volunteered for Gift of Hope, our local organ procurement organization, and shared the importance of becoming a registered organ donor with everyone in the community, including my family. And although the wait in Illinois is 5 to 7 years, at that time was 5 to 7 years for a deceased donor transplant, I received my gift in 3 years because of directed deceased donation. I received the generous gift of a second chance at life from a deceased donor, Milton, my hero, on the day before Thanksgiving in 2016. That was the best Thanksgiving ever. Because I had shared the message and the love of volunteering with my daughter, she got a job working as an outreach specialist with Gift of Hope. That had a major impact on my family. My volunteer roles led to my professional role at the National Kidney Foundation of Illinois. And soon after I began, we recruited a new CEO with a background in healthcare who engaged our board and our team in the strategic planning process. She understood the importance of aligning our work within the communities most in need. This was very impactful for our organization overall. I've recently had the opportunity to work with our team to create a community advisory board at NKFI with statewide partners to give input on the work that we're doing. In fact, we currently have a statewide outreach campaign called Kidney Health for Life, where we're partnering with faith-based organizations to have community health talks about kidney disease. This campaign is focused on the people who are most in need: Blacks, Latinos, and Asian American Pacific Islanders. We were able to get input and feedback from our community advisory board that will help us improve our campaign and heighten our impact on the community. Now I'll turn it back over to Jackie, who will talk more about how we're working to move kidney care up the healthcare continuum and impacting the community.
So thank you, Monica. Every time I hear your story and have the privilege of knowing your daughter, Olivia, and our all adopted baby, NKFI baby, your grandson, it just makes it's very profound, and it puts a face to the challenges, and it also motivates us to continue to move forward. So thank you for sharing your story. You identified, we've identified some of the risk factors, and one point we want to indicate here is that Blacks are nearly 4 times more likely to have kidney disease than whites, and Latina Hispanic population nearly 3 times more likely than whites. You did identify, the other populations of color that are represented here. So we see some of that aspect of the health disparity. So we talk about health equity and what are the barriers to health equity. So community disinvestment, we ask, where is the economic engine? Education and workforce challenges within communities, food deserts, or some people also call them food swamps, and the food deserts people are more familiar with. The food swamps are for communities that are inundated with the types of stores that have unhealthy food products. There's insufficient options for nutrition. Systemic racism that we're aware of that's present in the healthcare sector and other sectors and other business sectors. And one point we wanted to raise is that we call it the COVID-19 overlay. That COVID-19 did contribute to an increase in definitely acute kidney injury and chronic kidney disease during, particularly in the height, of the pandemic. And then the behavioral health challenges that are surrounded with not just COVID, but as being on dialysis, even from that standpoint. And this is at the end stages for end stage renal disease, kidney disease. So we look at some of that, and we look at, so what do we do? How can we start to make that difference? Well, a key area is in partnership. So Monica referenced, we have a strategic and intentional approach. This is like information from part of our strategic plan, our update to our strategic plan, where we look at the science and technology and care system, because what we do is grounded in the science. We look at financing models with value-based care, the impact, as well as managed care organizations, and without question, the most important impact on the population. When we talk about disparities, the difference between equality and equity, the social determinants, and then behavioral health integration. So a lot to look at, a lot to consider. And so what we wanted to share is the result of our initial strategic plan. We just starting to update that for 2020. Well, we've updated it for 2023 through 25. Wanted to talk a little bit about 2020 through 22 and our 4 strategic pillars that include building engagement with relevant evidence-based programming, increasing our brand recognition, strengthening our partnerships and collaborations, and diversifying and growing our funding. And this is all based on, these pillars are based on a sustainable organizational practice, that is ethical, as well as sitting on top of our mission, vision, and core values. So when we look and we sit back and we look at, I would say the broader spectrum of the value of moving kidney care up the continuum. So we know that even the CDC's chronic kidney disease initiative identifies prevent and manage risk factors, raise awareness, because we have found that is one of our biggest barriers, promote early diagnosis and management, and improve the outcomes. And when we talk about what's the advantage of earlier detection, and prevention is always preferred. When you look at secondary prevention which includes early detection, as well as an early diagnosis and stopping the progression, there clearly is a quality of life as well as a financial savings that's indicated here in the billions. So what happens with so what we do when we work with our communities, and there's a lot more, about the community piece, but just kind of wanting to give you a little bit, some of the science and what we have people ask for. If you're at risk, you're part of an at-risk group, you have uncontrolled diabetes and or hypertension, you have one or two of the other risk factors, as you go to see your primary care physician or get connected to one, or a provider and get connected to one, we advise people that there's 2 tests that is part of what we call a kidney profile that they should be requesting. At this, we're working really hard from a policy standpoint, as well as within all the markets, throughout the United States and very much in Illinois, to get a kidney profile that's part of a routine workup, what we call the routine workup. We're getting there, but these are the tests, a serum creatinine, which looks at your eGFR, your estimated glomerulus function, and then your urine albumin creatinine ratio, which is the first one is serum is from the blood. The second one is from a urine sample. And that helps. There's a formula is used, and it all helps to stage where you are. So this prior slide is a lot for people to take in. So our job is to make it where it's digestible, understandable, and we can get people to activate change. And so this is an example of what we state to our communities as we go out. If you have one risk factor, request this testing. If while we're focusing on moving care up the continuum, clearly as part of our broader mission, we work with and support persons that, of course, have been diagnosed throughout the continuum and at the later stages. And just want to give, this is a national conference, and just want to give some information on Illinois specifically, that there's 34,400 residents living with end-stage renal disease, about 21,000 on dialysis, around 12,000 or so with transplants from deceased or living donors. the question, the key is though the wait list, and I put it down here nationally. Is over 105,000 people that are waitlisted, and this is for kidneys. And then in Illinois, Monica alluded to some of this, is over 3,600 persons. The wait list can be around 5 years, which is why part of our education, we also promote living donation. So when we looked at our impact in terms of, so you have these strategies, you're moving forward. When we looked at our impact in 2020, and this was just, if you look at the blue chart, it's just pre-COVID, I'll put it that way. Yes, in Illinois, I think we shut down around the 15th or 20th, somewhere in that range of March. And so in terms of the number of screenings, we also fund research, the dollars allocated to research, the number of individuals participating in our walk. And then you switch over to 2021, where clearly we were on shutdown and our kidney mobile could not go out into the community. What we did, like many organizations, we pivoted to get our education and information out, and we partnered with food insecurity organizations like the Greater Food Depository, Feed America, Feed Illinois, and partnered with them at their giveaways, handed out information, handed out meal preparation information, diets, and menus. We were still able to give our research grants and provide our programming was virtual. What we so we were thrilled with that, and the opportunity to continue to make a difference during the height of the pandemic. As we began to emerge, what we recognized is that to touch the number of people we need to touch and to start to change the trajectory for kidney disease in Illinois into kidney health, we needed to expand our message and our outreach, align all components of our mission, and go further, deeper, and faster. So with that, we've talked a little bit, or you've heard us mention about the kidney mobile. And so the screenings aren't done in the van, the screenings are done within the community, and we partner with community-based and faith-based organizations. And in the most, I would say, we target marginalized and under-resourced communities to do our screenings. And so the testing that is listed here, where we test for kidney disease, diabetes, and high blood pressure, we travel throughout Illinois. When we look at, so that's part of prevention and early detection, as well as then we move in terms of slowing the progression. One of the programs that we partner with our national organization, that's an evidence-based program, is called Take Charge, a self-management program. We have in Illinois, we have on our staff, a professional nutritionist, Dr. Melissa Press. She's available at no charge for the public to call, ask questions, and we focus in on those that have kidney-specific questions, but she also answers general questions. And then our patient professional programming, because it's going to take the patient, the family, the medical profession, all working together. And then with our treatment options, Big Ask, Big Give, as I think I alluded to earlier, part of our helping our patients that are on dialysis really secure a living donor. And then we also are looking in that realm of home dialysis, increasing other modalities, and then engaging community health workers. So looking at some of our strategies and outcomes, clearly in the policy and advocacy area, because it all works together, we've been able to pass, with the support of our phenomenal elected officials in Illinois, the Living Donor Protection Act that passed in 2019. And what that act does, it basically supports persons that are just generous in giving the life-saving gift of or it's all organs, and for us, you know, the focus of a kidney, without discrimination from their job and or their insurer. We also were able to get past the authorization for the Illinois Kidney Disease Prevention and Education Task Force. It passed in 2019. Then we had the COVID disruption, and which has gone on for a couple of years. And now we're planning to have our first meeting before the end of this calendar year. And this is by statute, it's regulation in Illinois, where we will be developing a comprehensive kidney plan. So, and it's bipartisan. It includes, providers, it includes patients, it includes researchers. And so we'll be developing our comprehensive kidney plan. So that's how we have impact. And that's really through advocacy and policy is a big part of the empowerment segment of our mission. So if we look at prevention, education, and early detection through a relationship, and I missed one part, that our key strategy is collaboration. There's absolutely no way we can do this alone. We so value and appreciate our partners, our donors, our funders, our collaborators in helping us move this mission forward. So some examples here include that we have implemented or in the process of implementing even is we are able to expand throughout Illinois, and part of our strategic plan, we sat and looked at where we were serving. And even though the kidney burden, as we call it, epidemiologically, is more in the northern part of the state, in Chicago and the Collar counties, we are the National Kidney Foundation of Illinois, and we serve all of Illinois. And so geographic expansion is part of our goal. Through our partnership with the Illinois Public Health Association, we were able to increase the number of communities that we served. Through a partnership, we have collaboration with Baxter Corporation, their Black Care Initiative, and they have partnered with the Links Incorporated, which is an African-American professional women that are very civic and community minded. And what we did with NKF of Illinois, we served as the subject matter experts to create culturally sensitive education curriculum that the links, therefore, the designated chapters of the links went into the community to educate the community. We have created our kidney disease, and Monica mentioned this, our awareness campaign, Kidney Health for Life, formed the advisory board. And we have what we call traditional research to some of the academic institutions that we help fund, like our Young Investigator Award, our Innovation Award. And then we also support community-based research, and we participate in community-based research. Members of the NKFI staff are a part of a study of the impact of a gene, I just put APOL1, on the opportunity to engage in living donation. I know I've talked a lot. What I want to do now is just show a little bit of what's the impact then. So our Kidney Health for Life, we are so thrilled with this awareness campaign. Our board extended funding to fund this campaign. We realize people just they take their kidneys for granted. We all tend to take our kidneys for granted until they're not working. And so we needed to get out and spread the word, and how to do that in a strategic and intentional manner. We formulated this campaign, Kidney Health for Life. We retained just a dynamic PR firm with great expertise in relationships with corporate and within the community, Gold Star Communications, and they've been working with us. So since the campaign launch, we've had 53 stories in the media, being print, radio, TV. Over 21,000 people have visited our website. So we are tracking, because you have to measure what gets measured and goal gets done. And then over 6,000 Facebook followers. Our our point person on this initiative is our dynamic director of marketing communications, Sarah Jane Castro, and she works with all of us to make this happen. And we're particularly thrilled with the outcome and grateful for our media partners, because we have to remember Chicago is the third largest media market in the country. So it's not like people are sitting around, like the media is sitting around waiting for us to call. So getting the message out there, partnering is important. And then we have, and just to have our baseline, before the campaign, on average, we would have maybe 5 media related stories per year. So to go from 5 to 53, we're thrilled with that, but we know we even plan to go higher. And we also have our community health talks. And so the community health talks involve us meeting with community organizations. It's faith-based and community organizations. We bring in a speaker, we often have a patient, and we go through Kidney 101. We go through some of the key issues related to the at-risk status, treatment options. The provider is available to answer specific questions. And so we've done some in person and some virtually. So here's an example. We held one in East St. Louis at the end of July. You see some of the others that are scheduled just this past Sunday. We were at St. Sabina Catholic Church, which is a large Catholic and prestigious Catholic church in Chicago that is based in the African American community. And they also have part of their congregation is also Spanish speaking. We're reaching out. We have one scheduled this upcoming weekend with the Chinese Union. So again, we're looking at that diversity, that inclusion, and moving forward. So here's another example, in terms of our campaign. So we talk about program and outreach collaborations, and we talked about the impact, I mentioned rather the impact of nutrition. So what we do, we strategically were able to partner with Northwestern, Northwestern, the School of Medicine, as well as the community outreach area within Northwestern, and Andaleo, which is a community development arm of a faith-based organization of Trinity United Church here in the Metro Chicago area. And we're prescribing healthy food and nutrition. We are partnering with them. They are setting up a fresh food mart in under-resourced communities, in an under-resourced community from which multiple communities will be able to access. So an example of partnership. And these are just examples. When I said we're going to go further, deeper, expand more, go, and get deeper with our relationships and go faster. These are examples of just literally being in the community. Of course, we educate virtually where we reach more people. What we have found is that unique balance is impactful, where you do virtual, where you engage in virtual education, both professionally and if community-based, as well as just rolling up your sleeves and being in the community, having those conversations. And that also works as well for our professional. We just had a professional program last week. All right, a lot going on. Monica referenced our community advisory board. Thrilled to get that started. That's an initiative that she leads. Rachel DePaul, who is our senior director for programs, we have a professional advisory board, and research leads our professional, is the staff lead for our professional advisory board. Again, we have to educate on all levels on dealing with health equity as well as the science. So some of our emerging strategies, never sitting, being a learning organization was one of our core values. Never sitting on where we are and always striving to have additional impact. Our emerging strategies include participating with our national organization in developing a statewide summit and some evidence-based learning collaboratives. We will team that with our advocacy initiative to really engage multiple partners at multiple levels and segments within the health industry and community. Workforce development. So we are engaged on a task force with here in Illinois, we have an Illinois Kidney Care Alliance. So with our partners to really support the evolution of community health workers that are focused in the kidney space. So to be able to contribute as we do now, we have community health workers. To be able to contribute as we do now, as we have community health workers, and to expand that and expand it throughout Illinois is exciting. And of course, value-based care, working with managed care organizations. So that I definitely want to stop. I know we have time for questions, and want to thank you for attending. Monica and I both, greatly appreciate that, and we're here for questions. So Monica, if you want to, if some are listed in the chat, or let us know if people can unmute. If you want to help guide us through the question period, that would be fantastic.
Okay, I'm not sure how much time we have left. We were supposed to end about 4 minutes ago, but there is maybe a comment in the chat.
They're still here. Thank you.
Nobody left. Someone was unaware of food swamps. Had never heard of food swamps before. Let's see.
Yeah, I will say that was me. I'd never
Joy.
heard that. Yeah. And my wife and I live in Pittsburgh, and we live in a working class community. We both grew up working class. And when you said that, I was like, that's exactly right. We only have convenience stores and I won't say who they are, but a quote unquote, like dollar store, and all that they have, are foods that I would, say that most dietitians would consider unhealthy, and yeah, we're lucky enough to have a car to be able to go elsewhere, but I think about that all the time when I think about my neighbors, so yeah, I really appreciate y'all. And everything you shared was really super interesting, and I had no idea about the disparities. I mean, it makes sense, but I didn't know about the disparities for folks with kidney disease. So I super appreciate the presentation.
Thank you so much, Joy.
Thank you.
And then Carolyn was surprised by the statistics. She said these stats are mind-staggering.
I know I gave a lot, but I don't really apologize for it, because information is power, and having the data to back it up makes it measurable.
So I think that's all I see in the chat.
Are there other questions? People can want to unmute or ask a question. We always ask this, if there are persons that are directly impacted, or know someone, a family member, or know a friend that is impacted and doesn't mind disclosing, if they want to put their little raise the hand sign up or whatever. It never ceases to amaze us that when we do our outreach, our education, our advocacy, how many people we encounter that know someone with kidney disease. And
there's another question in the chat.
Oh,
how
sure.
How can we support NKFI's work?
We can go, I would say immediately, you can go to our website. And on our website, we have information about, so there's multiple ways. Let me stop. Through volunteering, as well as through financial contribution. And then volunteering takes on quite a depth. We need professional volunteers, we need event volunteers, we need people that will be in the community to help educate, and as well as, financial donations that help to underwrite and fund the mission. So www.nkfi.org. I didn't put that on here. I think Dr. J, I am going to get a slap on the wrist when this. So, Libby, I could do it now. If you go to nkfi.org, and then we're also on Facebook, Twitter, and then we have a podcast, The Journey Continues, that you can, I think, on one of these, add it up there.
The Journey Continues is available
Yes.
on all podcast
Yes.
platforms.
Yes, it is. Yes, it is. I thought I had it here. Oh, I think I skipped it. But anyway, I was going to show I had the little moniker, but it's up there. So, oh, here it is. Let me go up. So here's an example of it. The last one dealt with the games from the transplant games. So are there any other questions? All right. Well, thank you. Thank you so much for your time. Again, you can go to
One more
download.
question.
Oh, sure.
Do we have a big event in October or November?
Yes, we do. Our gala is going to be October the 13th at the Hyatt for those that are in the area or that want to come into the area. It is, our 37th gala on October the 13th at the Hyatt Regency downtown. That helps to fund our mission significantly. So we appreciate you can do a sponsorship. Our sponsor, you can find information about the sponsorship there, and our individual tickets are $350 per ticket. And so there's individual tickets as well as sponsorship opportunities. So that's also listed on the website. We're excited about our upcoming gala. We're going to have some entertainment. We haven't had entertainment for a while. COVID was such a disruptor. So we're going to have Joan Colosso there with a small number of members or part of her band. So we're excited about that. And we're honoring Frank Trella and his family. And then also the Illinois chapters of the Links Incorporated are our two honorees.
All right, I think that's it.
All right.
Okay, thank you, everyone.
Thank you. You all have a wonderful, wonderful afternoon. And we thank Diversity MBA for this opportunity.